will kick us off with this public hearing. Did I just... Ted, does it look like we have anyone on the YouTube, or for those of us for the government affairs team that are watching that?
Yes, we have a bunch of people on. We are ready when you are.
Excellent. Well, let's get started then. Thank you. Thank you so much. So welcome everyone to our Healthy Indiana Plan Rate Equalization Waiver Approval, public hearing number 1. So the second day of our MAC meeting, for those of you who attended the day 1. So this portion of the MAC meeting is just a public hearing. There's no formal presentation. We will start things off with the Office of General Counsel, Attorney Inka Henshaw. She will read to us our summary of proposed comments. And once we're done with that, I will provide instruction about how to access providing written commentary, and also your ability to provide oral commentary. So, Anka, if you would like to start us off.
Good afternoon. My name is Anka Henshaw. The Healthy Indiana Plan, commonly referred as HIP, is a health insurance program for qualified adults ages 19 to 64 who meet specific income levels. HIP has been a feature of Indiana Medicaid programs since 2008. Based on state statutory mandate, the HIP program has always paid providers at Medicare or 130% of Medicaid rates. Other Medicaid programs, fee-for-service, FFS, Hoosier HealthWise, and Hoosier Care Connect, have been paid at the regular Medicaid fee schedule. The final managed care rule published by CMS in November of 2020 disallowed the payment of disparate rates among managed care programs. As a result, FSSA submitted an emergency section 1115 waiver, 1115 waiver amendment, and received approval on July 26, 2022 to continue paying HIP providers at the current Medicare or 130% Medicaid rates through December 31st, 2023. The emergency approval allows FSSA a limited amount of time to align and equalize physician and ancillary service rates among managed care programs and to comply with the final federal managed care rule. All current HIP eligibility limits and requirements will remain unchanged. This amendment does not include any changes to the current benefits, cost sharing, or delivery system. All HIP members will continue to receive a comprehensive benefit package through the managed care entity, consistent with private market plans and compliant with all mandated essential health benefits as required by the Patient Protection and Affordable Care Act, ACA. Enrollees receiving services under the Substance Use Disorder, SUD, and requested Serious Mental Illness, SMI, component of the waiver extension will continue to receive services through the current delivery system. By January 1st, 2024, OMPP intends to have equalized rates among HIP, Hoosier HealthWise, Hoosier Care Connect, and FFS. FSSA shared an example methodology whereby aggregate provider payment levels will remain the same, with physician and ancillary rates decreasing in HIP and increasing in other programs. FSSA will continue to evaluate this and other equalization methodologies in the coming weeks and months. We look forward to stakeholder feedback on this item. The 30-day public comment period opened on August 3rd, 2022, with the publishing of the public notice in the Indiana Register and will close September 2nd, 2022 at 5:00 p.m. This topic was presented yesterday, day one of the quarterly MAC meeting, to the Medicaid Advisory Committee. Written comments may be submitted via email to SPACOMMENT, that is SPA comment at fssa.in.gov, or via mail at 402 West Washington Street, room W374, Indianapolis, Indiana 46204, to the attention of Lynn Mung, Lynn, L-Y-N-N-E, Mung, M-O-N-G. In addition, FSSA will host 2 public hearings during which the public may provide verbal comments. This is the first public hearing held as day 2 of the quarterly Medicaid Advisory Committee meeting, and the second will be held August 29th, 2022 at 10 a.m. until noon at the Indiana Government Center South Auditorium, 302 West Washington Street, Indianapolis, Indiana 46204. It may be attended in person or virtually via FSSA YouTube site. Now we are opening the hearing for public comment.
Thank you, Anka. I appreciate it. I'm going to share our next slide just so that everyone can see. So as a reminder, the links to the full public notice and a rate equalization approval letter have been posted publicly, and they are being posted in the YouTube chat for your convenience, so you can read what Anka just read. If you can make a public comment by providing your name and organization, if applicable, in the YouTube chat, and a member of our state team will provide you with the Zoom link so that you can come into the Zoom meeting to speak. We have a slide of instructions here as well for you to review. And just as a reminder, as Anka said, in writing, you can submit your SPA comments. You can submit your comments to our SPA comment mailbox. And then we are also having another public hearing next week on the 29th. The information is why. Okay, that's interesting. It's blank. Sorry, I do have this slide. I don't know why it's not showing. We'll make sure it does in a second. So should see that again. Just go back. We also we'll have I'll post the slide for the other public hearing as we approach the end of this meeting. And the other things, we also have a court reporter taking down all the comments, and we will review those, summarize those, and submit them to CMS. So state team, do we have anyone signed up for public comment?
It looks like Representative Robin Shackelford checked in. Would you like to make a statement, Representative Shackelford, or were you just logging your attendance?
Looks like Dr. Atler would like to come on and speak. Ted, can you provide her with the Zoom link, if not done already?
Okay.
Thank you. Sorry.
Meredith, can you hear me?
I can, Dr. Atler. Oh,
Yes,
sorry.
yes.
Sorry, I got your name wrong. Oh, embarrassing.
That's okay. Everybody gets my first name wrong too. My name is Dr. Leela Alter. I also sit on the MAC and represent the dental profession, but in my means today, I am actually presenting on the behalf of the Indiana Oral Health Coalition, where I am the chair. The Indiana Oral Health Coalition expresses concern about provider retention with the Healthy Indiana Plan Payment Policy, Emergency Section 1115 Waiver Amendment. While we acknowledge FSSA's efforts to maintain the current HIP reimbursement for 6 months following the end of the public health emergency or no later than December 31st, 2023, OMPP's plan to decrease HIP reimbursement and increase rates for fee-for-service, Hoosier HealthWise, and Hoosier Care Connect could have potential negative effects on dental provider participation in all programs. Besides a targeted rate increase for 84 CDT codes in 2008, Indiana dental providers have not had an increase in Medicaid reimbursement since 1999. While the 2015 HIP expansion, dental benefits were added to the HIP plan, and dental reimbursement was set at 130% of Medicaid rates for this plan. Prior to the 2015 HIP expansion, Indiana Medicaid had 1,275 unique dental providers. As of 2019, Indiana now has 2,188 unique dental providers. The majority of Indiana Medicaid dental providers are small business owners and are not employed by healthcare delivery systems. Personally, a week does not go by when I am not contacted by a Medicaid provider about Medicaid reimbursement. Many states have reevaluated Medicaid dental reimbursement and implemented increases in 2002, which includes Connecticut, Georgia, Illinois, Maryland, Michigan, Missouri, Nebraska, South Dakota, Tennessee, Vermont, Virginia, and Wisconsin. In 2019, the Bone Center for Health Workforce Research and Policy released a report on Indiana providers, reported barriers to Medicaid participation, physicians, and dentists. Out of the reporting sample of 1,604 dentists, 59.5% indicated that they are not accepting new Indiana Medicaid patients. The number one reason for not accepting new patients was due to low reimbursement rates. Indiana also continues to see an increase in dental health professional shortage areas and populations. According to July 2022 HRSA data, Indiana had an increase of 7 counties that are now experiencing a shortage area or population from 2019. Only 32 counties are not experiencing a shortage area or population. This is also contributing to the lack of access for our Medicaid members. 4 out of the 5 Indiana contracted managed care entities are unable to close their networks since they don't meet access requirements. For example, Lawrence County is not considered a DIPSA area. However, there are no general or pediatric dentists accepting new Medicaid patients in Lawrence County. The closest FQHC is located approximately a 40-minute drive to an adjacent county, and they are scheduling new patients in March of 2023. This FQHC also has 4 locations in Marion County, and they are also scheduling new patients in March 2023. The closest pediatric dental provider to Lawrence County that is accepting new Medicaid patients is located in Bartholomew County, which is scheduling new patients in May of 2023. While we appreciate FSSA's efforts to equalize reimbursement across all programs, there needs to be a parallel effort to increase dental Medicaid reimbursement with January 1st, 2024 implementation. Thank you very much. I appreciate the opportunity.
Thank you, Dr. Alter. I appreciate it. I also see Dr. Renee Shear. Are you on the Zoom and available to comment? I saw that you posted wanting to comment.
Yes, I am.
Thank you.
Thank you for
Sorry I
allowing me
missed
to
you
comment.
before.
Okay, it's okay. Hello, my name is Dr. Renee Shire. I have practiced dentistry for 24 years, all of which I have served as a Medicaid provider. I am the Indianapolis District Dental Society President, which is the largest component of the Indiana Dental Association. I've practiced at Pippin Dental in Indianapolis for over 11 years. As of the state's largest providers of Medicaid dental services to primarily children, Pippin Dental is an integral part of Indiana's healthcare safety net. Our 8 Indiana offices are part of the dwindling workforce that provides Medicaid dental services for underserved children, youth, and adults. Like other health professions, dentistry has suffered from the devastating effects of the pandemic. Increasing costs of supplies, workforce shortages, and increased demand for services have created exponential stresses on the industry that have already caused 2 of our Indiana locations to close their doors. We believe that children's dental service rates should be aligned with adult dental rates, and that the state should not decrease rates for HIP providers, but rather increase the rates paid in other Medicaid programs. The current reimbursement rate for children's dental services has not been increased for over 20 years. Recognizing the importance of oral health as part of overall health and extraordinary cost pressures, which started before the pandemic and heightened during, many states such as Missouri, Virginia, Massachusetts, and Maryland have already taken action to address chronically low reimbursement rates. For providers such as Pippin, who see 90% or more Medicaid patients, cost increases of 30 to 40% for labor and supplies, coupled with increased costs of pandemic-related safety measures, is unsustainable. We believe that Indiana should increase children's pediatric dental rates by 30% to align with the adult rate and stabilize market due to inflationary and labor challenges. Aligning children's rates to the current HIP Medicaid rate will allow us to hire and retain our workforce, allowing us to serve more patients and focus on preventative health rather than crisis intervention. Rate parity would allow providers to cover increasing operational costs and keep their doors open. As one of the largest providers of children's Medicaid services in the state, we have seen firsthand how rising operational costs put pressure on our ability to cover costs of providing care in the current market. These pressures particularly affect providers like Pippin, whose patient base is approximately 90% Medicaid. Safety net providers like us cannot shift rising costs to self or private pay patients like other providers. Rising costs make it more challenging to Medicaid providers to continue to operate in a state where there are already barriers to access and a shortage of providers that accept children with Medicaid. The oral health workforce is asking for the same interventions considered for medical providers like nurses, EMS, and behavioral health specialists. Our request for rate parity will provide a direct solution to dental workforce shortages outlined in the Governor's Public Health Commission report. Addressing these shortages is important to Hoosier Health. Research has shown that oral health is a vital part of a person's overall health. It deserves investment from the state, especially for our most vulnerable children. Thank you for your consideration, and I'm happy to answer any questions.
Thank you so much for your comment, Dr. Shearer. Sorry for the
welcome.
echo. Also signed up to requesting to speak is Dr. Elizabeth Strubble from ISMA.
Hi, can you hear me okay?
I can, you sound great. Thank you.
Great. Good afternoon. My name is Dr. Elizabeth Struble. I'm a board certified family medicine physician from North Manchester, Indiana, in the northern part of the state. And I'm the current president of the Indiana State Medical Association, which represents more than 9,600 Hoosier physicians, residents, and medical students. And I'm here today to share the concerns the ISMA has regarding the HIP equalization project. We are very glad to see that CMS approved the emergency amendment, which allows additional time to come in compliance with the rule and ensures continued federal match for the current provider rates and grants a waiver of the rate setting requirements until December 2023. We appreciate the diligent work negotiating with CMS to secure these flexibilities. As the state's largest physician organization, our membership includes physicians who practice in nearly every specialty area. We are always concerned about reimbursement rate changes that alter the rates for one specialty or program at the expense of another. Accordingly, we would encourage FSSA, the legislature, and other stakeholders to work toward a solution which does not reduce reimbursement rates for HIP 2.0 below 100% of Medicare rates. We believe a more prudent long-term solution would be to simply raise rates for Hoosier Care Connects, Hoosier HealthWise, and other Medicaid programs to align with current reimbursement for HIP 2.0. Since the state expanded Medicaid in 2015, adequate reimbursement rates for physician services have been critical to the success of HIP 2.0. Specifically, reimbursing for services at Medicare rates has helped drive physician participation in the program. At a time where access to care is an ongoing concern, regulators should be doing everything they can to encourage greater physician participation in HIP. Fair and adequate reimbursement for services is certainly one way of doing so. Should Indiana Medicaid raise rates for other programs, it will likely drive physician participation and therefore greater access to care in these programs, similar to the impact that the inclusion of Medicare rates has had on physician participation in the HIP 2.0 program. As I alluded to previously, it is also important that we find solutions that mitigate the impact on particular physician specialties as a result of this equalization project. ISMA is committed to work with stakeholders to find solutions which do not necessitate increasing reimbursement rates for one specialty at the expense of another. We understand that FSSA is working hard on a more detailed impact analysis of the proposed plan, and we look forward to reviewing and providing feedback on that outcome data. In closing, I would like to thank you again for the opportunity to speak today and offer cooperation and collaboration as you work to comply with the new CMS directive. We look forward to working with the FSSA, the General Assembly, and our physician colleagues to find a solution that continues to drive physician participation in the programs FSSA offers to Hoosier patients. Thank you very much, and I'm happy to answer any questions.
Thank you, Dr. Struble. I appreciate the comments. We did have a question in the YouTube chat about asking the state how we will notify all physicians and other providers of the change. We are working on a communication strategy. Obviously, the public hearings are a part of that. Additionally, we'll have banners and bulletins released and additional stakeholder meetings. And we're continuing to evaluate how else we.
Who is this speaking right now?
Oh, sorry, this is Meredith Edwards, our Director of Care Programs.
Okay. I'm not sure when it's you or when it's Anka.
I understand, yeah. Okay, so checking in with our state team. Is there anyone else in the YouTube chat requesting to speak? Again, you just post your name and organization and advice that you'd like to comment, and you'll be provided the Zoom link, and then you'll be notified when it's your turn. And hopefully I get you in the right order. since we have a bit of a lull, I am going to go to the next slide. For somehow I had marked the slide as like unviewable somehow. But just a reminder that this is, of course, our MAC Day 2 public hearing. And then we also have an in-person and virtual public hearing on August 29th from 10 a.m. to noon. And you'll note sometimes we say 402 West Washington and sometimes we say 302 West Washington. They are the same address. So if you mail something to 302 or 402, it's going to get there. We will continue to give it some time in case individuals come on to the public hearing late. We want to be sure that we can collect as much public feedback as possible. We really do appreciate all this information. Anyone who's jumping on now, we're just waiting to see if we have any other public comments. And if you do have a public comment that you'd like to provide, just put your name in the YouTube chat and you'll be provided with the Zoom link by the state staff. And you'll be notified when it's your turn to speak. I think we'll give it until 1:35, and if we don't have any other public comments at that time, we'll end this meeting early. Thank you. Okay, this is Meredith Edwards, our Medicaid Director of Care Programs, and I am going to just hop to our next slide as a reminder. We do have another public hearing. That one is on August 29th. That is in person and virtual. You should come check us out as we try to make that magic happen. It's from 10 a.m. to noon in the Government Center Auditorium. And again, if you want to submit written comment, you can do that through September 2nd at 5 p.m. through mail. Information, all of this information is available in the public notice that is posted online. And at this point then, plan to wrap up this public hearing. Thank you all for your participation. And I appreciate all the public comments we received. Thank you very much.